it's Nanette with Heart Baby Home. So today we're looking at heart number 41, which is Tetralogy of Fallot without pulmonary stenosis. So usually Tetralogy of Fallot has 4 heart defects, but without the pulmonary stenosis we are left with a large ventricular septal defect, an enlarged aorta, and right ventricular hypertrophy. Let's start with the VSD. So that is a hole in the septal wall that separates the right ventricle from the left ventricle, and that allows the oxygen-rich blood and the oxygen-poor blood to mix before leaving the heart. The enlarged aorta sits directly over the VSD, and it's just enlarged, it's bigger. And then the right ventricular hypertrophy. So if you can see the right ventricle compared to the normal heart, the wall is bigger. So that's because the right ventricle is having to work harder, and just like any muscle, when it works harder, then the muscle gets bigger. Now this isn't necessarily a good thing in your heart because it actually means your heart will wear out faster. And then this heart also has sub-aortic stenosis, and that's where just below the aortic valve there's a narrowing, usually because extra wall or some type of cell has grown there that narrows that pathway out of the left ventricle. I also see an atrial septal defect, which is a hole in the wall between the right and left atria that also allows for blood to mix when it shouldn't. And then there's also a PDA, the patent ductus arteriosus, and that's an extra pathway between the pulmonary artery and the aorta that everybody has before they're born, but it usually closes 2 to 10 days after birth. And in this case, where not enough blood is getting through the left ventricle into the aorta, extra blood is coming up through the pulmonary artery, and it'll shunt through that PDA and help get more blood out to the aorta and out to the body. But once that closes, then the defects will become more critical, and so they usually try to use medication to leave that PDA in a few extra days so the baby can grow and develop before they need surgery. Or sometimes the PDA won't close like it's supposed to, and so they'll go in and surgically close it, usually in a cath lab. And it looks like that's it for heart number 41. If you appreciate this video, please subscribe to my channel. If you have any questions or you'd like to contact me to have a new heart drawn, you can find me at heartbabyhome.com/contact. I'm also on Facebook and Twitter, and I look forward to hearing from you. Thank you so much.